Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. WHO prequalifies the first vaccine against Mpox. The World Health Organization has announced the MVA-BN vaccine as the first vaccine against Mpox to be added to its pre-qualification list. The first pre-qualification of a vaccine against Mpox is an important step in our fight against the disease, both in the context of the current outbreaks in Africa and in future, said WHO Director General Dr. Tedros Adhanom Ghebreyesus. We now need urgent scale-up in procurement, donations and rollout to ensure equitable access to vaccines where they are needed most, alongside other public health tools to prevent infections, stop transmission and save lives. The MVA-BN vaccine can be administered in people over 18 years of age as a 2-dose injection given 4 weeks apart. After prior cold storage, the vaccine can be kept at 2 to 8 degrees centigrade for up to 8 weeks. The WHO pre-qualification of the MVA-BN vaccine will help accelerate ongoing procurement of the Mpox vaccine by governments and international agencies such as Gavi and UNICEF to help communities on the front lines of the ongoing emergency in Africa and beyond, said Dr. Yukiko Nakatani, WHO Assistant Director General for Access to Medicines and Health Products. Study finds estrogen blockers do not elevate coronary heart disease risk in breast cancer cases. New evidence shows that the extended estrogen suppression treatment using aromatase inhibitors for hormone receptor positive postmenopausal breast cancer is safe. It does not increase the risk of coronary artery calcification, a sign of active coronary atherosclerosis, as some prior studies had indicated. An article in the Canadian Journal of Cardiology details the findings from a retrospective cross-sectional observational study that investigated the association between the duration of aromatase inhibitor treatment and the severity of coronary artery calcification in post-operative breast cancer patients. Lead investigator Yu Hiasa, MD, Department of Cardiology, Pulmonology, Hypertension, Nephrology, Ehime University, Graduate School of Medicine, Tune, Japan, explains although there is an ongoing discussion on the optimal duration of aromatase inhibitor therapy, our data suggest that longer aromatase inhibitor use, as often as used to prevent or suppress late recurrence or spread of breast cancer, is safe, at least in regard to coronary artery calcification. Research finds monoclonal antibodies may help combat antimicrobial resistance in hospital-acquired infections. Monoclonal antibodies, treatments developed by cloning a cell that makes an antibody, could help provide an answer to the growing problem of antimicrobial resistance, say scientists. A team led by researchers at the University of Cambridge has developed a monoclonal antibody drug using a technique involving genetically engineered mice that may help prevent infection from Acinetobacter baumannii, a bacteria associated with hospital-acquired infections, which is particularly common in Asia. Professor Stephen Baker from the Cambridge Institute of Therapeutic Immunology and Infectious Diseases at the University of Cambridge said that A. baumannii is good at sticking to medical equipment, and if people are vulnerable or don't have a particularly well-developed immune system, they can succumb to this infection and get aggressive pneumonia requiring ventilation. And in many cases, the patients can acquire the infection from the ventilation itself. The bacteria are naturally resistant to many antimicrobials, but as they are now found in hospitals, they've acquired resistance to almost everything we can use. In some hospitals in Asia, where the infections are most common, there isn't a single antibiotic that will work against them. They've become impossible to treat. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.